New tonight, a picture that a lot of people have found disturbing, and the city has confirmed this picture is real. This was taken yesterday at the Jacksonville Public Library downtown, which is home to the state-run monoclonal antibodies treatment center. The woman who posted it said people awaiting treatment were just crying out in pain. You can see two people on the ground there. Jacksonville was the first city to get one of these Regeneron pop-up facilities, which have been promoted by Governor Ron DeSantis as an important tool in the fight against COVID. On your side's Kaylee Tracy broke this story today, and Kaylee, this picture has really been upsetting to some people.
Hey Anthony, a lot of people expressing concern on social media that people in that condition should maybe be in a hospital instead of getting this treatment. City and state officials tell me at this site here, they have ramped up efforts to make sure everyone has a place to sit or lay down if they want, and make sure there is not a repeat of a scene like this one. This wasn't what anyone expected to see at a site the state promised would help in the fight against COVID. Officials for the state-run and city-supported treatment site at the Jacksonville Downtown Library confirmed these patients were waiting to receive injections of monoclonal antibodies. A city spokesperson said the scene was the result of large patient volume, which they say more than doubled Wednesday. Because of that, all of the available wheelchairs were in use, the city says. Today, the city says they're providing triple the number of wheelchairs and additional seating, as well as signs directing people to alert someone if they need assistance. The city sent an updated statement a few hours later calling the treatment, quote, the key to alleviating stress on our area hospitals, and thanking the governor for, quote, providing the treatment.
The idea here is you want to stop that virus from making copies of itself. The earlier you can do this with that monoclonal antibody, the less virus burden you're going to have in your body. Thereby, your immune system gets rid of the rest of it and your symptoms improve.
Dr. Shrag Patel, Assistant Chief Medical Officer at UF Health Jacksonville, says the sooner you get the treatment after a positive test, the better, and not later than 10 days after that positive test.
The longer you wait, the more and more virus burden you have, and it makes it that much harder for you to get over those symptoms. And in those cases, when you've got so much virus in your body, the symptoms can be a lot more severe, just like what you see in that picture.
City officials emphasize that the treatment is designed for people who have just recently tested positive for COVID, and that people who are experiencing severe symptoms should seek medical help. A state health department official says what happened in this photo is not representative of state sites. She said healthcare workers will make the call if someone seeking the treatment is too sick, and that ambulances are ready to take them to the hospital if needed. She also wanted to make it clear that monoclonal antibody treatment should not be seen as an alternative to vaccination, but as one more tool to help defeat the virus. And the site just closed at 5 today. Officials here say it has been steady again today. The treatment is for those 12 and older who have either tested positive for COVID or who are at high risk and were exposed to COVID. We have more details, including the hours of this site right now on firstcoastnews.com. We also have details on where else in the area you can get this treatment. For now, reporting live downtown, Kaylee Tracy, First Coast News on your side.
And let's